Oh, thank you very much. Thank you. So good morning, everyone, and welcome. My name is Alison Day. I'm a physiotherapist by background, and my current role as Head of Clinical Excellence for Ascenti allows me to sort of input and develop some of these novel or innovative services like this from a clinical perspective, where we obviously keep patient experience at the top of the agenda. I feel very proud to be here representing Ascenti at these awards, and I'd like to thank Penn for this opportunity. Ascenti's been nominated for the Innovative Use of Technology, Social and Digital Media Award, and I'd like to share with you this morning some of the highlights of our application. So the initiative that we presented to Penn for consideration in this category was the conversion of our largely in-person physiotherapy service to an entirely virtual service within a month. Now, I think for those of you, you might be thinking, well, this sounds fairly reasonable. You know, there's lots of small practices and businesses in the physiotherapy world that have probably managed something similar. So if I share with you the scale of our clinical operation, it might sound a little bit more award worthy. And I'm very excited I've got my Chris Whitty mug here to be able to say, next slide, please. And I've got to move my own slides on as well. So typically, Ascenti, for those of you that don't know who Ascenti are, we're a leading independent UK provider of physiotherapy and some selected clinical outsourcing services. And we provide physiotherapy to both the public and private sectors. Typically, we deliver in the region of 50,000 appointments a month across both public and private sector. And we've got around 300 directly employed physios, which as you can see from our map, we got physios and clinics in the southern tip of Cornwall right up to Edinburgh and Glasgow in Scotland. Having a network of physios directly employed by us allows us to make changes to systems and processes, implement technology and pathways quickly and effectively, which is one of our strengths. And that was key to the success of this initiative. We have a fantastic in-house tech development team, so our digital expertise was absolutely tested to the limits with a rollout of virtual training and new tech development, which included a patient app, which was embedded within our patient management software, so that results from the app, when patients engage with their exercises, it was pulled through into their clinical record, so we could keep an eye on engagement and we could message patients back and forth if they were struggling. So this was all thanks to our in-house tech team and many more staff and teams involved in this coordinated approach to this change. Next slide, please. So our aim was to continue to provide high quality care and provide a seamless patient experience. We were aiming to obviously create very strong patient outcomes, but wanted to maintain safe, low risk services to ensure patient safety. We wanted to make sure we still offered choice at a time where I think many patients felt there was no choice in terms of how they could access healthcare, and wanted to make sure any decisions they made were obviously informed and shared. And we really wanted to support our clinicians. It was a massive change for them in how traditional physiotherapy was being delivered. We wanted to make sure they had the tools they needed to feel effective and confident in their support with patients. Next slide, please. So preparations began from early March 2020, obviously when the initial announcements came out about the changes and lockdowns. We made sure that we were informing staff at every step of the way. We've got an award-winning internal communications software platform, and we ran daily drop-in sessions for staff to answer technical questions or clinical questions about how they might assess a certain condition virtually. So we were there to support staff every day, right the way, as I said, staff from Cornwall to Edinburgh were involved in those webinars. We started to recruit and employ staff with experience and specialisation in virtual care, and we also employed staff who'd experience in virtual training and digital teams to support this transformation for nearly 300 physios. Most importantly, we communicated with our patients, many of whom were expressing a sense of desperation that they were being told by their referring practitioners that, no physio would be available, nobody's having physio. And for them, it was, a sort of desperate situation. So for many, they felt it was a real lifeline to be offered the chance to speak to a physio and access some care virtually. Next slide, please. So outcomes and metrics from the service were analysed along with feedback from patients and clinicians. And throughout this period, we saw over 27,000 patients. Typically before the start of COVID, back in sort of February 2020, we only saw 1% of our patients virtually. This started to increase through March with the uptake of our services transforming and obviously patients being able to access that. So from the middle of March to the beginning of April, we converted to entirely 100% of our appointments being virtual. And this stayed high for 2 months. And then in line with the NHS Virtual First, we wanted to be able to make sure we could see a limited number of patients who either had features of significant pathology or were at risk of deteriorating physically or psychologically if they couldn't have contact with somebody face to face. So that number dropped to about 89% in June. But from June onwards, we've continued. Obviously, as services started to open last summer, we were seeing more and more people who were offered a choice. They were choosing to come into our clinics, which was, absolutely fine and safe for our clinicians and patients. But we reached a point in September where consistently a third of patients, even given the option of an in-clinic appointment, were still choosing virtual care. And this started to make us think, actually, this is something that it isn't just the only alternative through a pandemic. It was actually, for some people, it was a more preferable service than having to arrange time off work and childcare to try and come into a clinic. So throughout this period, 95% of patients were likely to recommend virtual physio to friends and family, and 98% were satisfied with the business response to COVID. And we did capture feedback from many of our patients, and Judith from Derbyshire was very kind and said that the video consultation was like a breath of fresh air. She felt understood and validated, like there was light at the end of the tunnel for the first time in months, and it felt like a lifeline. She was quite sceptical about online physio, which I think is something that was echoed through a lot of our interviews with patients, but she couldn't believe how well it worked. And 2 weeks after, implementing the treatment plan and following her little exercise videos on the app, she was back to work again and really felt like she had sort of broken the back of that situation and was living life to the full. So, and that was really supported by a lot of our patient experience through this conversion. Next slide, please. We were keen to share the results of our change and share the success with the rest of the industry. So we were able to publish the results of our evaluation as a white paper in June 2020. And then this was published further in the Chartered Society of Physiotherapy's innovation database in December 2020. Our publications of our papers received a lot of positive attention, with others in the provider space actually citing our work to gain traction for similar innovations in their own businesses. We also volunteered to support the Chartered Society of Physio in their national evaluation of remote services, the results of which are yet to be published in full. The key findings of our evaluation, we used the change in pain score. So we had a 11-point numerical rating scale for pain, which was one of our sort of primary outcome measures. And this actually revealed that a combination of virtual and in-person care yielded the greatest change in pain. And that was an improvement of 3.6 on the numerical rating scale on average. And this compared to a change of 3.4 for those that only received in-person care and 3.1 for those that received only virtual. So actually the combination of that input was the most effective. Patients with low pain scores, when they were initially seen, achieved very similar results, whether they were treated in person or virtually. So those with a low NRS score on entering the service had an improvement of about 1.5 on that scale with virtual and 1.6 with face-to-face. Those with a medium score had an average improvement of 3.5 with virtual, 3.6 with face-to-face. So again, tiny fraction more effective with in-person, but very similar changes. And then so I think what's really surprising is those patients with a high pain score, so that would be an NRS score of over 7 on entering the service, achieved substantial improvements with virtual care and a change score of 4.7. And that's really, I think, really quite astounding, because those are the patients who are often more challenging, have higher levels of distress, and perhaps those that you feel would actually traditionally benefit more from being seen in clinic. So yeah, we were really pleased with those results. So next slide, please. Thank you. So in conclusion, during the pandemic, Ascenti provided a high quality, safe service that enabled continuity of care for patients. We delivered strong patient outcomes and a seamless patient experience in our conversion to virtual care. We successfully supported and communicated with staff, which was crucial through what was a very significant change in their practice. And we enabled change for the better across our industry through publishing our virtual physio information and data. Next slide, please. So finally, in terms of what's next for us in terms of our sort of digital capabilities, we're looking to diversify our services, looking to extend our virtual capabilities and looking at group-based education and rehabilitation for those patients with persistent pain or long-term absence from work. We're looking at establishing virtual advanced practice services so that patients can access those assessment and diagnostics and investigations with our advanced practitioners virtually. Looking to expand the team and employ some virtual only physios and mentors, and not only just expand in terms of the numbers of staff, but also expand in their confidence and their competence through this platform of healthcare delivery. And I think we're obviously, whilst we're doing that, we're continuing to make sure we offer patients the choice of in-clinic or virtual care. And even now, we still have about 20 to 30% of patients choosing virtual care, even when they're offered an in-person appointment. I think it's definitely had benefits which we didn't foresee. And I think the clinicians have also fed back that they were surprised how much easier it was to empower patients to take control of some of their care, you know, and be involved more when it's virtual delivery. I think seeing patients in their home environment and allowing it means that advice and exercise and everything is more bespoke for them when you can see them in their home environment. So I think there was, you know, hidden benefits all round really, which we weren't expecting. And I think it's easy to get swept along with the digital transformation, and what we're making sure we do is continuing to keep our feet on the ground and evaluate the services and make sure we validate this approach to healthcare as safe and effective, so it's a viable option going forward rather than it just being the only option during a pandemic. So we're really excited to see what the future holds in this space. And yeah, thank you for your time. That's the end of my presentation.